So what our study was looking at, we had patients that were divided into 4 treatment groups. One of them was targeted monotherapies with agents such as TKIs and mTOR inhibitors, and then we had patients in 3 other treatment groups that were doublet combinations. One was patients that were receiving VEGF plus mTOR inhibitors, one that was receiving TKI plus IO combinations, and one that was receiving IO alone. And in our comparison, we saw that the patients that were receiving the doublet regimens, particularly the comparison that we made were the 2 groups with the targeted treatments as one component of them. So the VEGF plus mTOR inhibitor or the TKI plus IO had superior clinical outcomes to the monotherapy group. And so one of the kind of thought process behind why this might be the case is that in chromophobe kidney cancer, there are more mutations along the PTEN, PI3 kinase pathway, and that is targeted by mTOR inhibitors. And so there is some thought that the mTOR inhibitors, that was one of the combination groups that we had, have more efficacy in chromophobe kidney cancer. And then for the targeted agents themselves, we've seen kind of the biggest data set prospectively has been for the TKI-IO combination, the lenvatinib plus pembrolizumab thus far. So for patients with chromophobe kidney cancer with immunotherapies have had, as you were mentioning, kind of not as optimal outcomes with immune therapy as opposed to clear cell kidney cancer, which is the most common type where we've seen really great success with immunotherapies. In our analysis, we did have 2 groups where patients had immune therapies, the TKI-IO group and the IO alone group. And we actually did see some good efficacy in those combinations, particularly in the TKI-IO group, where patients were having kind of pretty significant clinical improvements in clinical outcomes with time to treatment failure and overall survival. One explanation for why immune therapies might not be as effective in chromophobe kidney cancer is that there's been studies that are looking at kind of the immune environment in chromophobe kidney cancer, and there's just a less active kind of T-cell involvement in immune environment that would be activated or kind of release the brakes on when you have immune checkpoint inhibition. So with that environment, they might not be as responsive to immune therapies. What we were hoping to do was essentially pool together outcomes from 3 different cancer centers and look at outcomes in time to treatment failure and overall survival. And the most clear conclusion that we drew from here was that doublet combinations with at least one targeted agent had superior outcomes compared to monotherapy. So from the data that we presented today, I would say the main conclusion is that for patients starting first-line treatment for metastatic chromophobe cancer, should start on a doublet regimen that's containing at least one targeted agent, whether that's a TKI or an mTOR inhibitor plus a VEGF inhibitor. What we're hoping to do, so right now the data that was presented today was from 3 different cancer centers. We're collaborating with 5 additional cancer centers, so we're hoping to increase our patient cohort so that we will have more patients across each of these groups, and then we can make more comparisons, especially with some of the more contemporary regimens that are being utilized and evaluated in chromophobe kidney cancer. I think kind of one of the highlights and kind of successes of this project was that we were able to collaborate with other institutions for a rare disease subtype, and I think something that's really important for a lot of these different, within common cancers, rare subtypes or rare cancers in general, looking at outcomes through different institutions across the country. And I think that makes it also a little bit more relatable for patients across the country as well.